Hi guys, thanks for joining us today. My name is Sachin and I'm one of the members of IR Juniors. And today we're really lucky to have two guest speakers. We've got Madhu and Jim joining us today to give their experience of the academic clinical fellowship. Just before we go on to that, we just wanted to give a little bit of a background about IR Juniors and what we're trying to do and our aims. So IR Juniors was started about 2 years ago, and the main aims were basically to raise awareness of interventional radiology and radiology amongst medical students and junior doctors. And we've done that by hosting webinars online, as well as application events and more specific events on interventional radiology and procedures. And we've also created a website through which we've got a lot of content on there as well. This is just a few examples of some of the events we've held online. So as part of the application series, last year we held one as well, through which we had a portfolio session, an MSRA session, interviews and choosing a training scheme. And we've got all of those sessions following this one in the next 4 to 5 months. So keep an eye out for those. We've also got a research collaborative as part of the Unite program. And through that, we're hosting monthly journal clubs. And there are various research projects that are ongoing as well. A couple of months ago, there was a Radiology for FY1 event, and we're also in the process of creating IR Bites, which are essentially free online educational segments for students and junior doctors. So that's something that we're working on and are looking to proceed ahead within the next few months as well. This is just our website. It's irjuniors.com. It's got sections for med students, junior doctors, radiology trainees. So whatever level, please do have a look. And this is just our YouTube site. So a lot of the videos and webinars we've hosted over the last 12 to 18 months are uploaded on here, especially the journal clubs and the application series from last year. So again, if you're interested, please do have a look and watch. And this is one of our big upcoming events, which will be on the 15th of October. It's our IR Research Day, which is held in collaboration with the British Society of Interventional Radiology Trainee Group. And essentially it will be a virtual conference online, and we'll just cover a lot of the ongoing research that's currently happening within IR. So if you're interested in research, which I assume many of you are, then please do have a look and check this out through the URL. And as part of this day, we're also hosting a pitching competition, which is where people are invited to submit a 60-second pitch about a QI project or an audit that they're interested in or that they've got the idea for. Please do send it to us, and we'll invite the top 5 people to come and present them on the day. And the person who comes first, or the group that comes first, will win a national prize of £100 as well. So definitely please have a look at this. It's a really good initiative, and the whole day should be really interesting. So yeah, keep an eye out for that. And this is the next part of this application series. Myself and Indra, who's also on the call, will be giving a little bit of a talk about applications and portfolios. So just keep an eye out for that. That will be on the 30th of September in the evening. So that's everything from me. I'm going to hand over to Madhu and Jim now, just to give them a little bit of an introduction. Madhu is currently an Oxford IR trainee who's completed her ACF. And Jim is a IR trainee as well up in Leeds, and he's done his ACF and is currently undertaking a PhD. So hand over to Madhu, who's going to start us off. Oh, 1 second.
Thanks, Sachin. Sorry about that. It just wouldn't let me unmute. You needed to.
Okay.
Thank you. Let me just share my screen first of all.
And any questions, please feel free to just use the Zoom chat.
Thanks. Can you see my screen, Sachin? Fab. So like Sachin said, my name's Madhu and I'm an ST4 trainee in Oxford, and I've just completed my ACF, which was ST1 to 3. And I'll be talking alongside Jim, who's out of programme at the moment and doing his PhD. So we're both members of the BSIR trainee committee, and we're going to cover a few different bits in the talk today. So taking you through the academic training structure, which you probably all know quite well, and then what the application was like for me, and kind of any tips and advice that I could share. We'll talk about our own ACFs and the pros and cons as we see it. I think we both feel like there are different times to do it that are better. And then Jim's going to share some insights about his PhD and how to gain funding, and also talk a little bit about research opportunities as a trainee. So the academic training structure is, as you know, decided by the NIHR, and the idea is that after your medical degree, you can go into an academic foundation program, and then from that into an ACF post, which usually lasts from ST1 to ST3. And the idea is that you don't prolong your training by doing this. It works reasonably well with radiology training. So that's the RCR radiology training superimposed on top of that. The only slight clash is the timing of the exam. So we've got our part 1 exam in ST1, and then part 2A in the middle of ST3 and part 2B in ST4. So just kind of balancing both of those can sometimes be a bit tricky, as we'll start talking about later on. So if you are thinking of applying, I think my biggest bit of advice would be to start thinking about it early. There's lots of information on the NIHR website, and in particular, there's a really good scoring template, which is how all the centres would shortlist candidates, and that tells you kind of where the points are for your application and allows you to strengthen your application in the areas that you need to. The other thing to think about when you start thinking about this is where you want to be in the country. And I think you kind of need to ask yourself whether it's location that's the most important, or whether it's radiology for sure, or academic for sure. And that helps you decide kind of which deaneries would be right for you. The jobs that turn up each year are different each year, and there's no kind of set rule saying that if there was an ACF last year, there will be one again, and it is variable year on year. This picture is one I've taken from the IR Juniors website showing all the ACF jobs in 2021. So it is variable, but usually if a centre has had an ACF in the last couple of years, it's worth contacting them to see if maybe they're going to have one again. I think making contact early is really important. Speak to the person who's the potential supervisor in that area. They're normally quite happy to arrange to meet you. I don't know if that would maybe be virtual now, but you know, saves you a trip if it is. And that gives you a great opportunity to ask your questions, find out about what kind of research they do, meet other people in the department, and also help you make contact with other current ACFs in that department who can tell you a bit about the applications process. So definitely make contact early. The NIHR always goes on about the 3 Ps, so person, place, and project. And that's how the person assessing you in your application form and your interview will really make that decision. So it's worth you thinking about that early on. So is this place right? What are the strengths of this deanery? And how can you show that you know those things and that you're really interested in their particular field of expertise with the resources that they have in that deanery? So really think about that from the beginning. I guess the other thing that I would say is that this was a piece of advice that I got, and I think it's really helpful, was to just apply to as many places as you see fit, because it's all free interview practice at the end of the day. So I definitely applied to places where I really wasn't sure that I would take the job, but it was great to have the interview practice. So think about that as well. The application process itself is first of all via oral, but the oral form is incredibly straightforward. I think as long as you can spell your name and your GMC number, you're in. And then after that, you have your white space questions, which when I applied were variable between deanery to deanery. But they're very, very consistent and predictable. These were all the questions that I got asked in my white space questions, but they are really incredibly predictable. And on the right-hand side, I've got the shortlisting performer from the NIHR website, just a little snippet of that. And really, if you look at that, that kind of tells you what questions that they'll ask and what points that you need to put down. This doesn't really involve any sort of kind of creative writing. The word limit's normally quite tight, and for a lot of things, they just want you to list things in bullet points rather than kind of describe things in a flowery way. So this is a pretty straightforward and pretty predictable form, and this is what will be used to shortlist. The interview itself is a little bit more freestyle. So some of the questions obviously can be, predicted in advance. So why do you want to do radiology? Why do you want to do an ACF? And questions about your application are completely fair game. So any research project or teaching experience that you've spoken about, they'll definitely ask you about. So it's worth knowing that really well. And then I think the most important thing to be prepared for in the interview is to show why you're applying to their programme. So show that you know what that deanery is very good at and how research works there. Show that you've spoken to, for example, the potential supervisor or current ACFs. I think all of that comes across really well. And lots of practice interviews help as well. I got a few kind of thinking on your feet questions. So both clinical and research. So I got asked a question about managing a particular clinical scenario from an imaging point of view, where they'd say, the surgeons have this patient who's coming with this, that, and the other, and what would be the most appropriate imaging test and why. And then my research thinking on your feet question was, I was given a graph from a research paper, and then given 2 or 3 questions and given 20 minutes before the interview to just answer those questions. That was handed over to the interviewers, and then they asked me about why I wrote my answers as I did. So again, not something entirely unpredictable, but just justify why you've said what you've said, and I don't think you can really prepare for these much more than that. And of course, don't forget that you have to do your usual radiology application for clinical benchmarking, which is, as Indra and Sachin will explain next week. I thought I'd tell you a little bit more about my journey so far and my training and kind of what I've got out of the ACF so far. I did my undergraduate degree in Cambridge and did an intercalated BA as part of that. And then I went to Birmingham to do an academic foundation programme for 2 years. That was in diabetes and endocrinology. And then following that, I moved to Oxford for my ACF in radiology. That was an ST1 to ST3 ACF, which I think is the most common time in your training to have an ACF post. For me, it worked as 1 day a week academic day release for 3 years. Which was great for kind of a more clinical long-term project, because it takes an incredibly long time to sort out approvals. So having the regular input of time every week was really helpful for that. But if you know that you want to do something a bit more kind of wet lab based, then that probably wouldn't be the right type of ACF to go for. And there are ACFs out there where you get a whole kind of 3-4 month block of time where you can achieve more in a lab if that's what you wanted to do. In my centre, there was one senior academic in the department, so there was no kind of choice as to who your supervisor would be, but there are senior colleagues who've been previous ACFs and who are now postdocs who had lots of projects going and were very good at supervising as well. So for me, I've had a reasonable amount of variety in the projects that I've been involved with as a result of my senior colleagues. So I've kind of ended up doing work in 2 quite different fields. So one in AI for predicting malignancy in lung cancer, and then another in high intensity focused ultrasound and using that to ablate sarcomas. So very different, but it's been good having the variety, because I think particularly when you start in ST1 and don't know very much about radiology, it can be quite tricky to drive a project yourself. You kind of need a more ready-made project that someone else has put in place, where you kind of come in and start collecting data, for example. Whereas as you develop your own research interests, as you go through your training, it's nice to have the time to build a project up from scratch, from a protocol to ethics, etc. And it's been nice being able to do both of those. There are some extra perks that come with the ACF, and these are probably similar across the country. So here we got to do a postgrad diploma in health research, which was kind of 6 different modules that you do at the university, and you get a qualification for it. And they're pretty helpful skills. So particularly skills such as medical statistics, writing a protocol, writing a paper. So quite helpful for getting on with research. We also have a organisation called UCAGS, which is essentially a clinical academic support system. So they give you a mentor, they give you an academic ARCP, and just a community of other ACFs and PhDs. So, you know, if you're really hitting a brick wall with your project, it's another source of help and support, which has been really helpful. And also they do fun kind of networking dinners and so on. So a really helpful thing to have on board. They also offer some extra funding, so particularly for things like traveling to conferences, and also small grants for a project if you should need a bit of funding for that. So UCAGS has been great in that way. I finished my ACF in at the end of July this year, and I've just started my IR training since then. In terms of pros and cons of the ACF, for me, the best thing about it was the protected time. The time is absolutely amazing, and you don't realise how much you can get done in that time. So yeah, the time is brilliant. Having said that, ST 1 and 2 in Oxford anyway is not particularly intense in terms of the on-call rota, etc. So if you are really interested in research, you can make that happen in your own time. But it is nice having protected time. The other kind of really big pro of the ACF is the chance to develop really good research skills. So, you know, whether or not I go on to do a PhD or just go on to do a research project as a jobbing clinician in the future, I think I've got the skills for that. And, you know, it helps to build your CV. So for going for a fellowship application for the PhD, it's super helpful to show that you've been through an ACF. And it's also a really nice opportunity to go traveling, but that's kind of dried up in the last couple of years. In terms of cons, I think the biggest challenge is that radiology is a really steep learning curve in ST1, and is so different to what you've done before that it can be quite tricky to obtain all of the same competencies and get through the same exams as your clinical colleagues in 75% of the time compared to them. And I think it just does mean that you end up feeling like you're doing 2 jobs at once, and sometimes feeling like you're doing both jobs badly, and having to work a lot in your own time to try and get both of them done. And I think that's the biggest con really, is that it's a bit different to, for example, how core medical or core surgical training would work, where you come into it having already a bit of an idea of what the job is like. The exams can be tough. There have been ACF trainees who've not got their exams first time here and in a few other deaneries. And I think the kind of take home point from there is that in radiology, you can't really do anything, including research, without getting your exams first. So that's always the thing to prioritize over research. But that can make it tricky to kind of use your ACF time for actual research as compared to for revision, for example. And then the last point I've put on here is something that Jim will touch on a bit more, but with starting an ACF in ST1, I think it takes a bit of time to identify what interests you in radiology, because you are so new to it in ST1, and that can mean that some of the research time that you have in ST1 is either dead time or spent working on someone else's project that you maybe later on realize isn't really aligned with your own interests. So there are pros and cons to doing your ACF at different times, but I think what I would say about doing it in ST1 to 3 is that you only kind of realize what's actually interesting to you a bit later on in that time. And what I've learned along the way. So I think it's really important to remind yourself why you're doing the research, and that it's for your patients, and it will make things better in the future. Probably the most important thing to say would be that resilience is key. You will have setbacks in your ACF, and you will have projects that go nowhere, and just need to keep chipping away at it and keep trying and not give up, and eventually things work out. And I've also put time management on there, although I don't feel like I'm particularly good at that or have learned how to do that very well, but I think that definitely helps. I'm going to pass over to Jim now.
Thanks, Madhu. I just need to comment and say that I think amongst clinical academics, there is a lot of imposter syndrome, and Madhu is a clear example of that, because she's one of the most organized people I know. So yeah, take what she says about her time management with a pinch of salt. So I just want to share a few of my experiences to add to Madhu's story. I went to medical school in Edinburgh many moons ago. I actually went into medical school thinking that I wanted to be a surgeon, so hence I decided to integrate in anatomy. So not really the most novel scientific research that I was doing, but certainly was an opportunity to develop some critical appraisal. You obviously write a thesis during your intercalated degree, and that's all useful skills to develop in your scientific writing. Another point that I want to emphasize is that it's never too early to start your research journey. And actually during medical school, things like student selected components, your electives, are really excellent opportunities to do some great research. And my first proper taste of research was actually during my medical elective, which was also the first time that I got exposure to radiology and interventional radiology as a potential career. And I was just really fortunate that when I was working with this research group, I did my elective in Columbia University in New York, and the research infrastructure in the US is far more robust than a lot of UK institutions. And so obtaining large data sets and having people help clean those data sets, there are teams of people already able to do that. So you as the sort of research team can then focus on the data analysis and focus on what research questions you want to ask. And actually, as a result of that elective, I was able to get a few things out of that project, which really helped my later applications to foundation and also to radiology and also to my ACF. So I then went to Leeds to do an academic foundation program, which is a vascular surgery themed program. So my 4-month job, which is the AFP block, was lab-based. So I was in a vascular biology lab. And although it gave me an opportunity to delve into lab-based research, I soon realized that that wasn't something that I was really that interested in. I was more interested in very clinically orientated research. So during the block, I was trying to seek out a few sort of small cohort studies to get involved with, and also to bulk up my sort of research portfolio. I also then shot myself in the foot in some ways and ended up buying a house in F2, which meant that I was a bit stuck with where I could spend the next few years of training. And so I applied to Leeds, hoping to get a radiology number, and was fortunate to get onto the Leeds radiology training scheme. This was not an ACF focused training, because at the time there was no ACF in radiology in Leeds. But as I started my radiology training, I continued to be involved with a few projects on the side, just through contacts that I made during foundation. And during the end of ST2, around that time, the research lead in the department was keen to develop an ACF post, and he was inquiring into interest from local trainees. Obviously, this would have to be advertised nationally as a post, but he wanted to make sure there was some internal interest. So I expressed interest and fortunately was able to get onto that ACF post, which started at ST3. So if you remember looking at Madhu's diagram of the ACF training, actually most radiology ACFs do start from ST1. So Leeds is a bit strange in that it has an ST3 entry ACF post. particularly with radiology being such a short training program, with most subspecialties, you finish your training within 5 years. This would potentially take you also up to CCT if you weren't on an IR training program as well. So that's something to bear in mind, which I'll touch upon. So when I then started my ACF, the clinical research which was happening in Leeds was mainly in functional cancer imaging. So I ended up doing projects with the main research lead in Leeds, who was a nuclear medicine physician. So a few projects looking at PET CT in head and neck and brain tumor response. And as Madhu alluded to, there is a lot of support for clinical academic trainees in most networks. So in the Yorkshire region, there's funded away days 3 times a year, where you go to quite a nice sort of country resort for a couple of days. The first night you have a dinner, networking, usually invited speaker from outside the region, and the second day is focused towards potentially grant applications and presentation skills to really help develop some of those useful transferable skills, which are useful for when you come to apply for fellowships, but also higher postdoctoral fellowships as well. And you get a bit more money through the clinical academic network for travel and for conferences. And this is in addition to the funding that you would get through your radiology training scheme as well. Because remember, the ACF gives you integrated academic time. So you are still in the training program, but you just have dedicated research time. And I ended up taking my research time as blocks. So within the year, I took a 3-month block of research time because it fitted with the work that I was doing. I was learning how to use particular softwares, going through lots of scans, and actually using a bulk of that time was more effective for those particular projects. But it just depends on what sort of work you are involved with as to how you use that. And there are other considerations as well when you take your research time. Do you stay on the on-call rota? Are you willing to take a slight pay cut and just kind of locum around that? So there are a few considerations that you may also think about. I then started my IR training at ST4 whilst I was still on the ACF. So then I was taking some research time during my IR training, and by about ST4, towards the end of ST4, I started looking at research grants to fund a PhD, and I applied to 2 different funding bodies with separate projects, one to the Medical Research Council and one to Cancer Research UK, and I was unsuccessful with my MRC application, which was a project around renal tumour biomarkers, but fortunately with the CR UK application, which was on prostate cancer, that was successful. And usually with these projects, if you're working a project from scratch, you need to factor in time to plan your supervisory team, the project, the aims, because some of these personal fellowship awards which you're applying for take a lot of time to actually work out. When people say really a year before you apply, you need to start thinking about the logistics and putting pen to paper. And the actual application form is a bit of a beast as well. So you will be using your ACF time potentially for this as well, because it does eat into your training otherwise. I then went out of program at the end of ST5, so I'm about just over a year into my PhD at this point, and I'll have a year left, my ST6 year, when I come back into training. Next slide, please, Madhu. So with this particular way into the ACF, clearly, again, you will have that protected research time because you are a slightly more senior trainee. You may have some more developed ideas about subspecialization and the anatomical areas or the disease processes that you're more interested in. And so that might help you focus your research interests. But as Madhu said, it really depends on what is the available expertise at your institution, because a lot of these ACF programs, they are sort of aligned to 1 or 2 research academics within the department. And so if there is a neuroradiologist who is the main research lead in the department, inevitably there will be a little bit of pressure for you to be involved with neuro research. I know some institutions will be very flexible and will be open to you doing other subspecialty research, but then the research expertise may not be there to best support you if it doesn't align in with what is available locally. So that's something to consider when you apply. And as Madhu said, it's really important to reach out early and have those discussions. Another thing to mention is not every year there will be a radiology ACF necessarily available, because radiology may be competing with other specialties for an ACF number. For example, this year in Leeds, when people were applying for the radiology ACFs, this most recent round, they were also competing with applicants to rheumatology ACFs. And actually the applicants were marked on merit and their own potential to be a clinical academic. So actually whoever was the most high scoring, say 2 or 3 applicants, that would determine which specialties would actually get these ACF numbers. So it's even more reason to try to boost your CV with getting some presentations and a few publications if possible at that stage. Another thing is, if you do research later on, perhaps your radiology skills will be more developed, you may be more confident in your general radiology skills, and that may allow you to also subsidize some of that research time if you're unbanded or not getting that additional funding with extra reporting. That's another opportunity to potentially supplement that pay. You also have had more time clearly to gain research contacts during your training, and even potentially outside of region to then develop those PhD fellowship applications. Again, the cons are that you're still doing 2 jobs. Once you're into your subspecialty training, particularly with intervention, you need to be in the lab doing these procedures. You can't watch procedures and be competent. You have to be doing them and going to clinic and getting all those non-procedural skills and decision-making experience, which ultimately are really important for you to become a competent consultant. So it is hard when you then have research time eating into this. Exams are always an issue in radiology because they're lumped really handily in the middle of your training. So at the first time that you sit your sort of ST4 FRCR 2B, that is when you're probably in the middle of your ACF, even if you start at ST3. So that's something to consider. And I would get these exams out of the way as soon as possible, so you don't have to worry about that. Again, a limitation of doing an ACF later on is that if you go out of program at ST5, like I did, really that leaves no time for you to come back into training and then apply for clinical lectureships, which will give you some additional research training. You would be looking then into CCTing, finishing your training, and then applying for advanced fellowships as a full-time clinical radiologist. And clearly with interventional radiology, as with surgical specialties, if you do your research training or your PhD later on, there's a risk of de-skilling to some degree, or not operating as much. But as a aside and as a way to get around this, you can come back and do a fellowship or some dedicated training in certain procedural skills to increase your confidence as well. So it's not the end of the world if you're later on in your training and you still would like to seek out research opportunities. Next slide, please, Madhu. So what are things you should consider when you're looking at PhD opportunities? First of all, why are you wanting to do a PhD? Is it because you're really interested in becoming a clinical academic? Do you want to just be a full-time clinical radiologist or interventionist and have those research skills that you developed during a PhD to then start up research yourself? Or do you want your own lab and run a lab group in the future? These are a few things that even at the junior stage, you can start thinking what you're really interested in long term, because you will have a very long career, and it's important that you have a very well balanced and some variety there to keep yourself enthused about your day-to-day work as well. Madhu's mentioned project, person, place, and these are all really important questions the funding bodies will ask of you when you come to apply, because they want to know that you are the best possible person to be applying. You need to convince them that with your track record, with your interests, you are very good candidates, likely to not just succeed in your PhD, but you have the potential to be a clinical academic in the future. With the project, this is really important as well, because the project has to be impactful. It has to improve patients' healthcare, improve patients' outcomes or satisfaction. And you have to, again, convince the funder that your project is worth them giving you a large sum of money to run this project. And the place, is there enough support around you for your project to succeed? Because if you are an amazing academic and the project is fantastic, but you don't have the necessary consultants or academics around you to support all the areas of your research. For example, if you're involved in AI research and you don't have an AI expert, then there's a risk that the project may not succeed or may not maximize its potential. And so the funder may consider other institutions where there's more support available. You need to look at local opportunities, ask around, see what funding there is available. Is there any local funding through charities that might be able to fund potentially part of your PhD? Then you don't need to obviously apply for such a large sum of money from these research bodies to actually fund that. When do you do a PhD? I would argue in radiology, if you can, the earlier you go out of training, then the more time you have to focus just on your subspecialty training when you come back from your PhD. You don't need to worry necessarily about de-skilling, about exams, because you go out early. And there is a potential window between ST1 and ST2 exams. After your physics and anatomy, there is now a sort of an 18-month, almost 18-month hiatus where you can bulk up some of your research portfolio and then apply for a PhD. So that might be a good time. And for funding, there are several different potential places you can look at. So there are research bodies such as the NIHR, the research arm of the NHS, and then research bodies like the Wellcome Trust and the Medical Research Council. And there's a whole host of charities as well, such as Cancer Research UK, British Heart Foundation, which support a lot of clinical academics. Royal colleges and industry are also potential funding sources. And as I said, there is a potential pay cut when you are a full-time academic, but you can again supplement this with doing some locum shifts or extra reporting. Next slide, please, Madhu. And I wanted to highlight a recent initiative that everyone on this panel has been involved with developing over the last 12 months, which is a UK IR trainee-led research collaborative. And the reason why we started this up was to try and give people across the UK who had interest in IR to start getting involved with some multi-center research and also audit projects, which would hopefully lead to some impactful publications. And again, this would acknowledge all the collaborators' input onto these projects. And there are very established models in collaborative research. So this is hopefully one resource you can look into if you're interested in getting involved with some national research, and just email the BSIRT email if you're interested in being involved. We have a couple of projects about to go live, so get in touch. And Madhu, next slides. The final thing I wanted to mention was something that Sachin has already discussed. We've got on the 15th of October this research day, which will expand upon some of the things that Madhu and I have talked about, but will also give you an insight into people who are a few more years ahead of us, who have transitioned from a PhD into a postdoctoral researcher and fitting in their radiology and IR work around that research, and also established academics within IR who now run international research, have been successful in running clinical trials. And that's really the goal for many of us to aim for, as to being independent researchers in the future. So that's all for me. So I guess we can go on to discussion.
Thanks very much, guys. It was really, really good to hear from both of you and your different journeys. It was quite nice to see the slightly different types of ACFs that are out there, and the different stages that you can start at. So thank you to both of you. Just waiting, if there are any questions, please do put them in the chat. We've got 10-15 minutes to go through for a Q&A now. Just while we're waiting for questions to come through, just something that I was just thinking of for both of you. If you are already in a training scheme and you're applying for an ACF in your ST2 or ST3 years, how does it usually work if your current scheme doesn't offer an ACF and you're applying to a different scheme? do you normally have to move and just transfer to that scheme, I assume?
Yeah, so I can answer that. From the Leeds experience, that's right. If there isn't an ACF ST3 option at your institution, the ST3 post you apply for would carry with its ACF post the national training number. So you wouldn't worry about the issues you'd have with an interdeanery transfer. You would just apply. If you were successful, the deanery would automatically move you to the region of the ACF. So actually our most recent ACF is not from the region. So they transferred from outside of the scheme. And again, if you are moving schemes, then there are a few additional practicalities that you would have to look into. Obviously, potentially if you're moving across the country, then logistically, then that might come with financial implications. So I would again say look into those opportunities early and get in touch. Obviously, if you know trainees in those regions with ST3 posts, get in touch with them. They can put you in touch with the research supervisors. And if obviously that is an area of research that you are interested in and both those things align, then that's a great opportunity. But I wouldn't necessarily just go for it because it's an ST3 ACF. Because one thing I guess I should have highlighted is you can still do PhDs and apply for PhDs if you're not an ACF. The ACF just gives you some protected time because it's quite hard to do two sorts of full-time roles at the same time. And if you are doing research on the side, that does not stop you from then going for these PhD fellowships. I don't want to put off people who aren't in ACFs or actually don't want to go into ACFs. You can very much still do research that's impactful and also go out of programs with PhDs.
Thanks. That's really, really helpful to know, actually. There is one question that's come through. So just asking, do you know about other ACF programs in Oxford? Okay, so it's about other ACF programs in Oxford, potentially other subjects like anesthesia or cardiology. Also, if you do ST1 ACF, does that mean you are guaranteed training beyond ST3? So I guess the main relevant question is, if you do ST1 ACF, does that mean you're guaranteed training beyond ST3?
So in radiology, yes, because it's run through training. So yeah, you absolutely are. You're going to be in the same deanery until ST5 or ST6 if you want to do IR or neuro IR. In terms of the first part of the question and other ACF programs, there are loads of other ACF programs in Oxford, and I think it's variable as to what gets released year on year. And like Jim said, the ACF posts are often shared between specialties. So when I applied, there was a job that was shared between radiology and haematology, and they would just pick the best candidate, just like Jim said. So there usually are posts in almost every specialty. It's just a case of how many other specialties you're in competition with for that post, and they are different year on year. So have a look at the NIHR website.
And I think there's one other question that's come through. So if you're doing the normal foundation program instead of an AFP, would it put you at a disadvantage when applying for the ACF? Or could you compensate by doing your own research in your own time during a normal foundation program?
I think you absolutely can. I think it's more about your output commensurate with your level of training as compared to whether or not you've held an AFP. I think the only benefit of an AFP is that it gives you a bit of protected time to get some output. But actually, if you've managed to do that in your own time, you could almost sell that as showing your own initiative above and beyond what an AFP would have done, because you've done it in your own evenings and weekends. So I don't think that would put you at a disadvantage. I don't know what you think, Jim.
Yeah, I think when we listen to the senior academics in the Yorkshire region, they're always saying they're looking for people who have the potential to succeed. And there will be students and junior doctors who just have had the same opportunities to get involved with projects for their level of training. And as you say, Madhu, when you come to apply for whether it's AFP or ACFs, it's appropriate to their level of research experience and what stage of training there are, because you may be competing with people who have done a PhD before even going into medical school. So they're clearly going to have more on their CV, but it's specific to what level you're at. And you can absolutely sell if you're someone who's been interested in research and on the side of a standard foundation program, being able to publish and present things, that you are demonstrating that independence and that motivation to succeed. If anything, if you're doing an AFP and you haven't had an output from that, they may even ask what your output was from your foundation program research project. So it doesn't stop you at all.
We've got a couple more that have come through. So how common is it for people to need to take a year out post F2 to get ACF or even radiology numbers in general?
So I think both Jim and I went straight into radiology training from F2. I mean, in my deanery, I know a lot of people who've done that without taking a year out between F2 and radiology, but equally, I know a fair few people who've had time out or who've maybe done other training programs for a couple of years and then come to radiology a bit later. I think ultimately it doesn't matter how you do it, but the only caveat to that would be that if you've had multiple years out of training between F2 and applying for an ACF or applying for radiology, they will expect to see what you've achieved in that time. And in some ways, the expectation is maybe a bit greater if you've had more time since you've graduated from medical school. So make sure that you've got something to show for all the time you've taken out to show, whether you've done a teaching fellow post or you've presented at a conference or published something. Just make sure you can make it count.
Yeah, I would agree. I think for the research component, if you're wanting to be involved with any sort of academic program, then maintaining ongoing research projects and having consistent output every year, whether it's presentations or some form of project work that you can describe at interview, that's really essential. I think for the radiology component, most people are now going from foundation, unless there are people who are changing careers and they are moving from, for example, surgery to radiology, and clearly they may have undertaken a few more years of a different core surgical training program, but more people are going straight from foundation. And it's not common necessarily for people to deliberately decide to take a year out before radiology training, because there aren't really many standalone radiology programs out there. Unlike, you can get teaching fellow posts in certain specialties or clinical fellow posts, which are 1-year posts, which has a degree of service provision and maybe like a medical education component, which then naturally fits into a certain specialty application. With radiology, it's so different, the training structure is so different that although you can sell the skills that you've learned from maybe doing something else, there isn't a direct intermediate path into radiology. You can also obviously do PhDs before specialty training, but again, because radiology is potentially quite niche, if you're developing a project from scratch, that would be really quite difficult unless you had those contacts in place to pull those supervisors into an application. Remember, a lot of these funding bodies want you to be doing collaborative research with other specialties. So it's not just radiologists you need to know, it's computer scientists, it's physicians, surgeons, people who have some skill that they're offering into your research or academic development. So in some ways it's easier once you're in the subspecialty training to actually find those contacts for you then to strengthen your application for external funding.
And yeah, just to weigh in, I think with regards to the general applications, from my experience, and I'm sure Indra's had similar experiences, lots of people going straight from F2 nowadays. And I think it's easy. There's enough time within foundation program to get your portfolio ready to apply it in the middle of F2. So I think it's more like a personal choice about whether you want an F3 or not, or whether you want some time out before you start training, essentially. There have been another couple of messages sent through. As an AFP interested in getting into ACF, how important is it to have publications related to radiology? Perhaps Madhu?
So I didn't have any publications related to radiology. My AFP was in diabetes and endocrine, and I had a couple of publications related to that. And then my intercalated BA at university, that was in physiology, and it was a lab-based project on preeclampsia, so very much obs and gynae. So two completely different fields. And I don't think that disadvantages you. I think people appreciate that radiology, like Jim said, doesn't have a good kind of precursor pathway. It is its own specialty. There's no kind of pre-training for it. It's very rare to get a foundation job in radiology, and I think it's very rare to get an AFP job in radiology. I'm not sure if they exist, to be honest. So I think people understand that your research experiences have been different before you've come in. And as long as you can show that you've got the potential to repeat your kind of research output in radiology, I think that's absolutely fine. I don't think you'll be penalised for not having a radiology specific paper.
Yeah, I think I also didn't have any radiology specific publications, I think, at the time of applying for AFP. And again, a publication is a publication. If you have demonstrated you've contributed to your original research, that can obviously show that you have understood a research question, you developed hypothesis, you're already developing some of those really important research skills, which these senior academics at the interview will be, wanting for you to potentially discuss about. I would say that if you're involved with projects now, trying to, bulk up your CV for future applications, try to get involved with original research, even if it's retrospective studies. These are all good studies which can get you a publication and are well viewed upon. Sometimes people may, because there might be a shorter time window, try to bash out lots of case reports, for example, and just to show that they've got several publications, and then you look and a few of them might be case reports. I would say your time is better invested in actually doing a piece of original research. I think that would be viewed upon with more highly at the point of application. So that's something, but it doesn't have to be radiology specific for the reasons we've already alluded to.
And just to chip in with that as well, on my interview panel for my Oxford ACF, I think there were 8 or 9 people on the panel, of which only 2 were radiologists. There were a load of haematologists on the panel because they were interviewing half of the haematology candidates for the same job. And I think given that only 2 people are radiologists, they can't kind of mark your application on the basis of what you've already done in radiology. I think it's all about potential.
So yeah, just a question from my end. I was hoping if you could just maybe let us know, if say for a trainee who's a non-ACF, either in foundation or even in radiology, how we go about getting training and research methods to then maybe either apply for ACF next, or maybe even apply for further funding or doing a project. Because obviously it's nice to have ACF with the diploma, Madhu, like you were saying, but are there any other ways we can do that, seek that training out ourselves?
So I think pick your projects wisely, because if you are working with an established research group, you're going to get a good experience from a training perspective out of that. For example, in Leeds now, the areas which have more developed research in radiology are in functional cancer imaging. So there are established collaborations with statisticians, with the trials unit, with computer scientists. So there's opportunity to learn some R statistics, some Python code. You can work with this clinical research unit to develop your knowledge of trials, different types of study design. So those are all really useful skills, but actually other skills which you subconsciously will be developing doing any project are critical appraisal, how to do an effective literature review. Critical appraisal of papers can be a cohort study to something much more advanced, such as like a meta-analysis. And some of those you need to spend some time to learn about. And if you can get onto a local diploma or even a postgraduate certificate in medical research, that might open some doors and help you understand, because you can then talk through talk through those skills. And also online courses. There's so much stuff now online, probably that there are free courses you can sign up to at least get that ball rolling. I know Code Academy have several free courses you can start enrolling into. And as long as you have that interest and you set aside time, I think it's just the time investment with these things. Usually I find myself, I want to do all these things, and then 6 months later, I'm not done any of them because I'm nowhere near as organized as Madhu.
That's not true. But the only thing I'd say in addition to that is, in addition to the time investment, it can be a bit of a money investment as well. Because, for example, a PG diploma or a certificate, if it's not fully funded by an ACF, they can be quite expensive. But you know, well worth the payoff in terms of the skills you gain, and it's also an extra qualification for you.
You could also try to ask your training scheme if they'll part fund some of these, but it depends on how lenient they are, I guess. But they've not had to fund presumably that much over the last 18 months. So, you know, ask. If you don't ask, you don't get what you don't ask for, right? So explore those options.
I was just wondering, actually, were there any particular resources you guys used for interviews or anything like that? I know it was a few years ago, but were there any particular books or what sorts of things did you guys use?
There's a black and white book that's like the medical interview Bible. That was pretty good. I think Radiology Cafe had a whole host of interview questions on there. I think you can kind of predict what the questions would be. You know, be willing to talk about your applications. Anything that you've listed on there, you should be able to talk about what you got out of it and what your particular role was in that project. And then be willing to talk about your future plans, where you see yourself in the future, what work you've already done in terms of establishing with the supervisors at that institution, what you may end up spending your ACF on. I think that shows that you're, you know, quite a well-considered candidate. I can't think of any other resources in particular. Jim, was there anything else you used?
No, I think speaking to other ACFs across the country, and also knowing your own CV and portfolio very well, and having ideas on how you want to develop your own career, because they also want to see that you've thought about it and you are aware of the clinical academic training process, and you're not just going for this because you've got some publications, so why not? They want to see that you've considered the future as well, and just don't for me, there was always a risk of being too rigid and preparing answers for things, and I think in these situations they know to maybe throw in some curveballs and ask you some maybe questions just about, how would you say run a lab, what are the key skills that you think you should have to successfully run a lab, or run a project in a team, and they just want you to talk through team management skills, communication, some of those key words. So sometimes having a bit of an open mind will help you perform better, so you're not too rigid at the time.
Another resource that Jim and I were talking about earlier to highlight is the Crash podcast. So Tom Termazai, who was the RCR traveling professor last year, got together a series of 5 different podcasts from people at different stages of their academic training in radiology. So starting with people like me and Jim doing ACFs, to people who are kind of a bit later in their training or in early consultanthood, starting out becoming independent, and then to really well-established professors. And there was also a podcast, I think, on women in radiology research, and just the insights from that were really interesting. So I think if you are thinking of possibly applying for an ACF or a PhD, or even not sure whether it's for you, I think it's well worth a listen. It's really interesting.
Amazing, thanks guys. I think that we have covered most of the questions now, and I've asked what I was thinking. Indra, did you have anything else you wanted to ask at this point, or?
No, nothing else. Just thanks for the talk. I think it was really useful to get an insight from both of you on the application process, and just things we should think about and ways we can get academic experience at all levels, because it's nice to know there's lots of different levels at which you can get involved, and I think just knowing about all of those was really useful. So yeah, thanks guys, and thanks everyone for coming.
Yeah, definitely. Thanks very much to both of you. We'll be sending out some feedback forms, so if you guys could fill that in, that would be really, really helpful for all of us as well. But thank you again to both of you, and thanks everyone for joining us. See you guys later.
Thank you.
Thank you.
Thanks, everyone.